You don't have to stop being sexually active because you're on your period. Some women report that having sex while menstruating is more enjoyable than at other times of the month. Having an orgasm helps alleviate period-related symptoms like cramping, and the reduced need for lubrication is a welcome side effect. Some people have less discomfort from migraines and cluster headaches after engaging in sexual activity, according to a research published in Cephalalgia. Doctor of Gynecology Carrie Coleman of Boston's MGH argues that all women should find pleasure in sexual activity. Having effective methods of contraception and STI protection in place during the menstrual cycle will greatly increase your comfort and safety. Make sure you know the risks of sexually transmitted illnesses, other infections, and pregnancy, including during your period, before you engage in sexual activity. What follows is advice for practicing period-safe sex. Danger of contracting an infection from having sexual contact during your period. When you're on your period, it's especially important to avoid risky sexual behavior since that's when you're most susceptible to contracting and spreading sexually transmitted infections like HIV. Menstrual blood might include the virus and other infectious organisms. Therefore, the use of a condom is highly recommended by medical professionals to lessen this danger. Anecdotally, there are two explanations for this risk, says Lauren Stryker, MD, a clinical professor of obstetrics and gynecology at Northwestern University's Feinberg School of Medicine in Chicago. She explains that the cervix opens slightly during menstruation, making it possible for viruses to enter the body. Some text goes here: any bodily fluid may transmit HIV or other STIs, she says. Moreover, you may be at a high risk of contracting several diseases right now. In accordance with the recommendations of the American Congress of Obstetricians and Gynecologists, your vaginal pH ranges from 3.8 to 4.5 during the course of the month. But because blood's pH is greater during menstruation, yeast can multiply at a faster rate. Vaginal yeast infections are more common in the week leading up to your period, and sexual activity at this time might make symptoms worse. However, there is a lack of conclusive data suggesting that having intercourse while menstruating increases the likelihood of developing a yeast infection. The unpleasant urinary tract infection is another possibility. After having sex, some women might be more prone to experiencing urinary tract infections, adds Dr. Coleman. This is most common during the ovulation phase of the menstrual cycle but can occur at any time, because germs can readily migrate to the bladder during sexual activity. Pregnancy dangers when you're having your period. Yes, you may get pregnant while having your period if you have intercourse at the end of your period and have a shorter menstrual cycle, which is normally 21 to 24 days. Considering that sperm may live in the vagina for up to 5 days, it's crucial that you keep using birth control to avoid becoming pregnant. Reduced need for vaginal lubrication. If you participate in sexual activity while menstruating, you may find that you don't need extra lubricants since the menstrual discharge itself makes for a smoother experience. Obs/Gyne James Simon, MD, a clinical professor of obstetrics and gynecology at the George Washington University School of Medicine in Washington, D.C., believes that water-based lubricants are readily accessible and safe both for sex and for condoms. Water-based and hybrid silicone and silicone-based lubricants are also safe for use with condoms and during sexual activity. He warns against using oil-based lubricants with latex condoms, saying, "Oil-based lubricants, and especially mineral oil-based lubricants, might degrade condoms and increase the chance of breaking." How sexual activity during your period can ease period pain. Having sex during your period may help alleviate some of the negative effects of PMS, such as cramps, sorrow, and despair. According to Dr. Stryker, la petite mort may alleviate certain menstrual problems because orgasms stimulate the production of endorphins. These are feel-good chemicals like oxytocin and dopamine. However, women with endometriosis may feel increased pain and other symptoms during menstruation and during sexual activity or orgasm. However, help is at hand, and sexual activity need not to be painful. Don't delay in seeing a doctor. The sooner you get help, the sooner you'll start feeling better and can get back to enjoying sex. Experiencing sexual arousal while menstruating. Since your hormone levels are fluctuating, you may experience increased sexual arousal and sensitivity during this time of the month. A heightened sense of tightness in the pelvic region is a common symptom of PMS and may also boost your libido. However, some women may find it difficult to have sex because they are more sensitive during their periods. There are birth control methods that can reduce the duration, severity, and frequency of your period, or perhaps remove it completely, if you choose to avoid having sex during your period.